negative health effects. Example: a person who smokes may struggle to quit, even after experiencing health issues like coughing or shortness of breath, due to their dependence on nicotine. Conclusion: understanding autism spectrum disorder, attention deficit hyperactivity disorder, and various substance-related and addictive disorders is essential for recognizing the challenges individuals face. Each of these conditions has unique symptoms and impacts on daily life. By understanding these disorders, we can better support individuals in seeking help and finding appropriate treatment. This knowledge also fosters empathy and awareness, helping to reduce stigma around mental health and addiction issues. Neurodevelopmental disorders diagnosed in infancy, childhood, or adolescence, communication disorders, depressive disorders, disruptive mood dysregulation disorder, persistent depressive disorder, chronic major depressive disorder, premenstrual dysphoric disorder, bereavement exclusion. Chronic major depressive disorder is characterized by persistent and severe symptoms that interfere with daily functioning. The symptoms must last for at least 2 weeks to qualify for a diagnosis. Here are the key symptoms associated with chronic MDD. 1. Persistent sadness, a constant feeling of sadness, emptiness, or hopelessness that lasts most of the day, nearly every day. 2. Loss of interest or pleasure, a marked decrease in interest or pleasure in almost all activities, including those that were once enjoyable, such as hobbies, socializing, or work. 3. Changes in appetite, significant weight loss or gain, or changes in appetite. 4. Sleep disturbances, insomnia or hypersomnia nearly every day. 5. Fatigue or loss of energy, a constant feeling of tiredness or lack of energy, even after rest. 6. Feelings of worthlessness or guilt, excessive or inappropriate feelings of guilt or worthlessness, often related to past failures or self-blame. 7. Difficulty concentrating, trouble focusing, making decisions, or thinking clearly. Individuals may feel mentally sluggish or easily distracted. 8. Psychomotor agitation or retardation, observable restlessness or slowed physical movements and speech. 9. Recurrent thoughts of death or suicide, frequent thoughts about death, suicidal ideation, or suicide attempts. Important note: it's essential to understand that not everyone with chronic MDD will experience all of these symptoms, and their severity can vary from person to person. If someone is experiencing several of these symptoms, especially thoughts of self-harm or suicide, it is important to seek help from a mental health professional. Obsessive-compulsive and related disorders, hoarding disorder, excoriation, hair pulling. Understanding obsessive-compulsive and related disorders. Obsessive-compulsive and related disorders are a group of mental health conditions characterized by the presence of obsessions and compulsions. These disorders can significantly impact a person's daily life. In this explanation, we will focus on 3 specific disorders: hoarding disorder, excoriation, and hair pulling disorder. 1. Hoarding disorder. Hoarding disorder is a condition characterized by the excessive accumulation of items and the inability to discard them, leading to clutter that interferes with a person's living space and daily functioning. Key features: accumulation of items. Individuals with hoarding disorder collect and keep a large number of items, such as newspapers, clothes, or other objects, regardless of their actual value. Emotional attachment. People often have a strong emotional attachment to their possessions. They may feel that these items hold significant meaning or that they might need them in the future. Difficulty discarding. Even when items are useless or have little value, individuals struggle to let them go, leading to cluttered living spaces that can be unsafe or unsanitary. Example: a person with hoarding disorder might have a home filled with stacks of old newspapers and magazines, making it difficult to walk through the rooms. They may feel anxious at the thought of throwing anything away, believing they might need it someday. 2. Excoriation disorder. Excoriation disorder, commonly known as skin picking, involves repeatedly picking at one's own skin, resulting in lesions or damage. This behavior often serves as a way to cope with anxiety or stress. Key features: repetitive skin picking. Individuals repeatedly pick at their skin, which can lead to noticeable skin damage, scabs, or infections. Triggers. The urge to pick may be triggered by feelings of stress, anxiety, or boredom. Some may pick at their skin unconsciously while watching TV or working. Emotional relief. Many individuals report feeling a sense of relief or gratification temporarily after picking at their skin, even though it can lead to regret or shame afterward. Example: a teenager with excoriation disorder might spend a significant amount of time picking at their arms or face, leading to visible scars. They might feel compelled to do this when they're stressed out about school or social situations. 3. Hair pulling disorder. Trichotillomania is a mental health condition characterized by the compulsive urge to pull out one's hair, leading to noticeable hair loss and distress. Key features: compulsive hair pulling. Individuals may pull hair from their scalp, eyebrows, eyelashes, or other body areas. This can result in bald spots or thinning hair. Triggers. Similar to skin picking, hair pulling can be triggered by stress, anxiety, or boredom. It can also occur when a person is focused on something else, such as reading or watching TV. Emotional impact. Many individuals feel a temporary sense of relief or satisfaction after pulling their hair, but they may also experience shame, embarrassment, or frustration about their behavior. Example: a young adult with trichotillomania may have patches of hair missing from their scalp due to repeated pulling. They might try to hide it with hats or hairstyles, but they continue to struggle with the urge to pull hair, especially during stressful times. Conclusion: obsessive-compulsive and related disorders, including hoarding disorder, excoriation disorder, and trichotillomania, can significantly affect individuals' lives. These disorders involve compulsive behaviors that often serve as coping mechanisms for anxiety or stress, but can lead to negative consequences. Understanding these disorders is essential for recognizing their impact and supporting those who may be struggling with them. Early intervention and treatment can help individuals manage their symptoms and improve their quality of life. Post-traumatic stress disorder, new criteria: preschool, PTSD, subtype, dissociative subtype. Understanding post-traumatic stress disorder. Post-traumatic stress disorder is a mental health condition that can develop after someone has experienced or witnessed a traumatic event. This disorder can significantly affect a person's daily life, relationships, and overall well-being. In this explanation, we will cover the new criteria for PTSD, the preschool PTSD subtype, and the dissociative subtype. 1. Overview of PTSD. PTSD is often associated with experiences such as combat, natural disasters, serious accidents, or personal assaults. People with PTSD may experience intense distress, flashbacks, or nightmares related to the traumatic event. Key symptoms of PTSD: intrusive thoughts, recurrent and unwanted memories of the traumatic event. Avoidance: steering clear of reminders, thoughts, or conversations about the trauma. Negative changes in mood: feelings of hopelessness, detachment, or a lack of interest in activities once enjoyed. Increased arousal: symptoms such as irritability, difficulty sleeping, or being easily startled. 2. New criteria for PTSD. The diagnostic criteria for PTSD have evolved, particularly with the release of the DSM-5. Here are some key updates in the criteria. A. Exposure to a traumatic event. To be diagnosed with PTSD, a person must have been exposed to a traumatic event in one of several ways. Directly experiencing the trauma, witnessing the trauma happening to others, learning that a traumatic event occurred to a close friend or family member, experiencing repeated or extreme exposure to aversive details of the trauma. B. Symptoms. The symptoms must last for more than a month and cause significant distress or impairment in functioning. The symptoms are grouped into 4 categories. 1. Intrusive symptoms: flashbacks, nightmares, or intrusive memories. 2. Avoidance symptoms: avoiding reminders of the trauma. 3. Negative alterations in mood and cognition: negative thoughts, feelings of detachment, or inability to experience positive emotions. 4. Arousal symptoms: hypervigilance, exaggerated startle response, and difficulty concentrating. 3. Preschool PTSD subtype. The preschool PTSD subtype is a new classification introduced in the DSM-5 that recognizes the unique way PTSD can manifest in younger children, particularly those aged 6 and under. Key features of preschool PTSD. Symptoms may present differently. Young children may not express their trauma in the same way as older children or adults. Instead of flashbacks, they may have frightening dreams or play out the trauma in their playtime activities. Difficulty with emotion regulation. Preschoolers may show increased irritability, tantrums, or changes in behavior, such as becoming more clingy or withdrawn. Example: a preschool child who has experienced a traumatic event, such as a car accident, may have nightmares about the event and exhibit fear when getting into a car, or they might reenact the accident while playing with toys. 4. Dissociative subtype. The dissociative subtype of PTSD recognizes that some individuals may experience dissociation as a significant symptom of their disorder. Dissociation is a mental process where a person disconnects from their thoughts, feelings, or sense of identity. Key features of the dissociative subtype. Dissociative symptoms. This can include feelings of detachment from oneself or feeling disconnected from reality. Impact on experience of trauma. Individuals with this subtype may have difficulty recalling aspects of the trauma or may feel as though they're observing themselves from outside their body during the traumatic event. Example: an adult with the dissociative subtype of PTSD might relive their trauma, but feel as if they're watching it happen to someone else, making it harder for them to process the emotions associated with the event. Conclusion: post-traumatic stress disorder is a serious mental health condition that can arise after experiencing or witnessing trauma. The new criteria in the DSM-5 help to clarify the symptoms and experiences of those affected by PTSD, including the preschool PTSD subtype and the dissociative subtype. Understanding these nuances is crucial for recognizing and providing appropriate support and treatment for individuals dealing with PTSD. Early intervention and effective therapeutic approaches can help individuals manage their symptoms and improve their quality of life. Somatic symptom disorder: feeding and eating disorders, bulimia, nervosa, binge eating disorder, gender dysphoria, sleep-wake disorders. Paraphilic disorders: intellectual disability, personality disorders, mood disorders, anxiety disorders, phobias, panic attacks. Dissociative identity disorder, eating disorders, assessment tools, clinical interview, IQ testing. Personality test, suicide risk assessment. Understanding various mental health disorders and assessment tools. In this explanation, we will cover a range of mental health disorders, including somatic symptom disorder, feeding and eating disorders, gender dysphoria, sleep-wake disorders, paraphilic disorders, intellectual disability, personality disorders, mood disorders, anxiety disorders, phobias, panic attacks, dissociative identity disorder, and eating disorders. We will also discuss assessment tools used in mental health evaluations, such as clinical interviews, IQ testing, personality tests, and suicide risk assessments. 1. Somatic symptom disorder. Somatic symptom disorder, formerly known as hypochondriasis, involve having physical symptoms that cause significant distress or impairment, even if there is no medical explanation for them. Key features. Focus on physical symptoms. Individuals with SSD may experience pain, fatigue, or other symptoms that lead them to believe they have serious illness. Excessive worry. There is often excessive worry about health, leading to frequent medical visits and tests. Impact on daily life. These symptoms can interfere with daily activities and relationships. Example: a person may frequently visit doctors because they believe they have a serious illness, despite medical tests showing nothing is wrong. Their constant worry and focus on their health can impact their job and relationships. 2. Feeding and eating disorders. Feeding and eating disorders are characterized by unhealthy eating behaviors and concerns about body weight or shape. 1. Bulimia nervosa. Definition: bulimia nervosa involves episodes of binge eating, followed by compensatory behaviors to prevent weight gain, such as vomiting, excessive exercise, or fasting. Key features: individuals often feel a lack of control during binge episodes and experience guilt afterward. Example: a teenager might eat a large quantity of food in one sitting and then force themselves to vomit to avoid gaining weight. 2. Binge eating disorder. Definition: this disorder involves recurrent episodes of binge eating without compensatory behaviors. Individuals may eat large amounts of food even when not hungry. Key features: feelings of shame or distress often accompany binge episodes. Example: a person may eat large quantities of food alone at night, feeling out of control, but not engaging in purging behaviors afterward. 3. Gender dysphoria. Gender dysphoria is the psychological distress that arises from a discrepancy between a person's assigned gender at birth and their experienced or expressed gender identity. Key features: discomfort with assigned gender. Individuals may feel uncomfortable with their physical bodies or societal expectations associated with their assigned gender. Desire for transition. Many individuals seek to transition to their identified gender through social, medical, or legal changes. Example: a person assigned female at birth may feel that they are male and take steps to express their gender identity, such as changing their name and appearance. 4. Sleep-wake disorders. Sleep-wake disorders encompass a range of issues related to sleep, including difficulty falling asleep, staying asleep, or experiencing restful sleep. Key types: insomnia, difficulty falling or staying asleep. Sleep apnea, breathing interruptions during sleep, leading to poor sleep quality. Narcolepsy, sudden and uncontrollable episodes of sleep during the day. Example: a person with insomnia may lie awake for hours each night, feeling tired and irritable during the day due to lack of sleep. 5. Paraphilic disorders. Paraphilic disorders involve intense sexual interests that may cause distress or impairment in functioning. These interests may involve atypical objects, situations, or individuals. Key types: exhibitionism, exposing oneself to non-consenting individuals. Fetishism, sexual arousal from non-human objects or specific body parts. Example: an individual with exhibitionism may derive sexual pleasure from exposing themselves in public places, which can lead to legal and social consequences. 6. Intellectual disability. Intellectual disability is characterized by limitations in intellectual functioning and adaptive behavior, which affect daily living skills. Key features: IQ score. Typically, an IQ score below 70 is indicative of ID. Adaptive functioning deficits, challenges in communication, self-care, and social skills. Example: a child with ID may struggle to learn basic academic skills and may require special education support to develop life skills. 7. Personality disorders. Personality disorders are a group of mental health conditions characterized by enduring patterns of behavior, cognition, and inner experience that deviate from cultural expectations. Example: borderline personality disorder. Definition: BPD involves intense emotional instability, impulsive behaviors, and difficulties in relationships. Key features: individuals may experience rapid mood swings, fear of abandonment, and self-harming behaviors. Example: a person with BPD might have extreme reactions to perceived rejection, leading to intense emotional outbursts and difficulty maintaining stable relationships. 8. Mood disorders. Mood disorders are characterized by significant disturbances in mood, such as prolonged periods of depression or elevated mood. Key types: major depressive disorder, persistent feelings of sadness and loss of interest. Bipolar disorder, alternating periods of depression and mania. Example: a person with MDD may feel hopeless and lose interest in activities they once enjoyed, while someone with bipolar disorder may experience extreme highs followed by deep lows. 9. Anxiety disorders. Anxiety disorders involve excessive fear or worry that interferes with daily life. Key types: generalized anxiety disorder, chronic and excessive worry about various aspects of life. Social anxiety disorder, intense fear of social situations and being judged by others. Example: a student with GAD may constantly worry about grades, future plans, and social interactions, leading to difficulty concentrating and increased stress. 10. Phobias. Phobias are intense, irrational fears of specific objects, situations, or activities. Key features. Avoidance behavior. Individuals often go to great lengths to avoid the feared object or situation. Disproportionate response. The fear experienced is often out of proportion to the actual danger posed. Example. Someone with a fear of spiders may feel panic and anxiety at the mere sight of a spider, even if it poses no real threat. 11. Panic attacks. Panic attacks are sudden episodes of intense fear or discomfort that peak within minutes and can include physical and psychological symptoms. Key types. Situationally bound cued. Panic attacks that occur in response to specific triggers or situations. Uncued, unexpected. Panic attacks that occur without any clear trigger, often leading to fear of future attacks. Example. A person may experience a panic attack while driving or while sitting at home with no identifiable stressor. 12. Dissociative identity disorder. Dissociative identity disorder, formerly known as multiple personality disorder, is characterized by the presence of two or more distinct personality states or identities within a single individual. Key features. Altered sense of self. Each identity may have its own name, history, and characteristics. Memory gaps. Individuals may experience gaps in memory related to everyday events, personal information, or traumatic experiences. Example. A person with DID might switch between different identities during stressful situations, with each identity having its own way of responding to challenges. 13. Assessment tools. Assessment tools are essential for diagnosing and understanding mental health conditions. Some commonly used tools include clinical interview. Purpose: a conversation between a mental health professional and a client to gather information about symptoms, history, and functioning. Structure: it can be structured or unstructured. IQ testing. Definition: intelligence quotient tests measure cognitive abilities and intellectual potential. Percentiles indicate the percentage of people who scored below a particular score. Standard deviation, a measure of variability that indicates how much scores deviate from the average. Z-scores indicate how many standard deviations a score is from the mean. T-scores, standardized scores with a mean of 50 and a standard deviation of 10. Standiness, a method of scaling test scores on a 9-point scale. Personality tests. Purpose: assess personality traits and characteristics, often used to understand behavior and interpersonal relationships. Examples: the Minnesota Multiphasic Personality Inventory and the Myers-Briggs Type Indicator. Suicide risk assessment. Is path warm, a mnemonic used to remember the warning signs of suicide risk. Ideation S. Substance abuse P. Purposelessness A. Anxiety T. Happedash. Hopelessness V. Withdrawal A. Anger R. Recklessness M. Mood changes. Conclusion. Understanding the various mental health disorders and assessment tools is essential for recognizing and addressing the challenges individuals may face. Each disorder has its own unique characteristics, symptoms, and impacts on daily life. By using appropriate assessment tools, mental health professionals can diagnose conditions accurately and develop effective treatment plans. Early identification and intervention are critical for helping individuals manage their symptoms and improve their overall well-being. 3. Ethical and legal issues. Ethics guidelines sexual relationships with clients, students, supervises confidentiality, informed consent disclosure of information, e.g., divorce intent, pro bono services mandatory ethics versus aspirational ethics record keeping, progress notes versus process notes, client access to records fee, splitting referrals, managed care limitations, managed care ethics, HIPAA, transfer plans, answering machines, and cell phones. Fact Security National Provider Identifier ACA Code of Ethics NBCC Code of Ethics Cultural Sensitivity in Ethics Conversion Reparative Therapy. The personal is political, cultural encapsulation, non-maleficence, beneficence, fidelity. Understanding ethical and legal issues in counseling. Ethical and legal issues are essential aspects of counseling and mental health practice. They guide professionals in providing safe, respectful, and effective care while protecting clients' rights. This explanation will cover various topics related to ethics in counseling, including guidelines, confidentiality, informed consent, and more. 1. Ethics guidelines. Ethics guidelines are a set of principles established by professional organizations to guide counselors in their practice. These guidelines help ensure that counselors act in a manner that is respectful, fair, and in the best interest of their clients. Key points. Professional standards. Ethics guidelines set standards for behavior and decision-making in counseling. Accountability. Counselors are held accountable for their actions and decisions based on these guidelines. 2. Sexual relationships with clients, students, and supervisors. Counselors are generally prohibited from engaging in sexual relationships with clients, students, or supervisors. This is due to the inherent power imbalance in these relationships. Key points. Exploitation risk. Sexual relationships can exploit the vulnerable position of clients and lead to harm. Professional boundaries. Maintaining clear boundaries is crucial for building trust and ensuring effective therapy. Example: if a counselor begins a romantic relationship with a client, it can compromise the therapeutic process and may lead to ethical violations. 3. Confidentiality. Confidentiality means that the information shared between a client and counselor is kept private. This is a fundamental aspect of the therapeutic relationship. Key points. Trust. Clients are more likely to share personal information if they know it will be kept confidential. Legal limits. There are exceptions to confidentiality, such as when a client poses a threat to themselves or others, or if there is suspicion of abuse. Example: if a client shares thoughts of self-harm, the counselor may have a legal obligation to break confidentiality to ensure the client's safety. 4. Informed consent. Informed consent is the process of providing clients with clear information about the counseling process, including potential risks, benefits, and confidentiality limits, before they agree to participate. Key points. Empowerment. Informed consent empowers clients to make choices about their treatment. Transparency. Counselors must explain their methods, fees, and any potential conflicts of interest. Example: before starting therapy, a counselor should explain how sessions will be conducted, the treatment approach, and the client's rights regarding their information. 5. Disclosure of information. Disclosing information refers to sharing details about a client's situation with others, which typically requires the client's consent. However, there are situations where disclosure may be necessary, such as in cases of divorce intent. Key points. Legal obligations. Counselors may be required to disclose specific information to comply with legal requirements or court orders. Client's best interest. Disclosures should always consider the best interest of the client. Example: if a client is going through a divorce and wants the counselor to provide information to their attorney, the counselor should obtain consent before sharing any details. 6. Pro bono services. Pro bono services refer to providing counseling services for free or at a reduced cost to those in need. This aligns with aspirational ethics, which encourage counselors to strive for the highest ethical standards in their practice. Key points. Social responsibility. Offering pro bono services demonstrates a commitment to social justice and helping underserved populations. Ethical aspiration. While not mandatory, pro bono work reflects a counselor's dedication to ethical practice. 7. Mandatory ethics versus aspirational ethics. Mandatory ethics. These are the minimum standards of ethical practice that counselors are required to follow. Violating these standards can lead to disciplinary action. Aspirational ethics. These are higher ideals that counselors strive for to provide the best care possible. They go beyond just avoiding harm and emphasize positive contributions to clients' well-being. Example: mandatory ethics may require confidentiality, while aspirational ethics might encourage counselors to actively advocate for clients' rights. 8. Record keeping. Counselors must maintain accurate and thorough records of their sessions, which can include progress notes and process notes. Key points. Progress notes. Brief summaries of what occurred during sessions, focusing on treatment progress and goals. Process notes. Detailed notes that include personal reflections and thoughts of the counselor, which are often kept private. 9. Client access to records. Clients generally have the right to access their records, which helps promote transparency and trust in the therapeutic relationship. Key points. Right to review. Clients can request to see their records, and counselors must comply unless specific exceptions apply. Informed decisions. Access to records allows clients to be more informed about their treatment and progress. 10. Fee splitting. Fee splitting refers to the practice of sharing fees with another professional for referring clients. This practice is generally considered unethical. Key points. Conflict of interest. Fee splitting can create conflicts of interest and compromise the integrity of the therapeutic relationship. Transparency. Counselors should always be transparent with clients about financial arrangements. 11. Referrals. Counselors may need to refer clients to other professionals for specialized services or support. Key points. Best interest of the client. Referrals should be made when it is in the best interest of the client and when the counselor feels they cannot provide appropriate care. Ethical responsibility. Counselors should provide referrals to qualified professionals and ensure the transition is smooth for the client. 12. Managed care limitations. Managed care refers to health insurance plans that provide a network of healthcare providers to control costs. These plans can impose limitations on the number of sessions or types of treatment available. Key points. Impact on treatment. Managed care can restrict the options available to clients and may lead to inadequate treatment. Ethical considerations. Counselors must navigate the balance between providing quality care and adhering to managed care requirements. 13. Managed care ethics. Counselors working with managed care must adhere to ethical guidelines while navigating insurance policies and limitations. Key points. Advocacy. Counselors may need to advocate for their clients to ensure they receive necessary care despite managed care restrictions. Transparency. Counselors should inform clients about their managed care plans and what services are covered. 14. HIPAA is a federal law that protects the privacy and security of individuals' health information. Key points. Confidentiality requirements. HIPAA requires counselors to safeguard client information and limit disclosures without consent. Client rights. Clients have rights regarding their health information, including the ability to request corrections and access records. 15. Transfer plans. Transfer plans involve a process for transitioning a client to another provider when necessary, ensuring continuity of care. Key points. Client support. Counselors should help clients understand the transition process and provide referrals to appropriate professionals. Communication. Clear communication with both the client and the new provider is essential for effective transfer. 16. Answering machines and cell phones. Counselors must consider confidentiality when using answering machines or cell phones to communicate with clients. Key points. Secure communication. Counselors should avoid discussing sensitive information over these mediums and inform clients about potential risks. Client preference. Counselors should respect clients' preferences for communication methods. 17. Fax security. When sending documents via fax, counselors must ensure that the information remains confidential and secure. Key points. Secure faxes. Use secure fax machines and verify the recipient's information to prevent unauthorized access to sensitive data. Client consent. Obtain consent from clients before sending their information via fax. 18. National Provider Identifier. The National Provider Identifier is a unique identification number assigned to healthcare providers in the United States. Key points. Standardization. The NPI helps standardize the identification of healthcare providers and simplifies billing and insurance processes. Mandatory use. All healthcare providers must use their NPI when submitting claims to insurance companies. 19. ACA Code of Ethics. The American Counseling Association Code of Ethics provides guidelines for ethical practice in counseling. Key points. Professional conduct. The ACA Code outlines standards for professional behavior, including confidentiality, informed consent, and cultural competence. Client welfare. The primary focus of the ACA Code is to protect the well-being of clients. 20. NBCC Code of Ethics. The National Board for Certified Counselors Code of Ethics serves as another set of ethical guidelines for counselors. Key points. Certification standards. The NBCC Code emphasizes the importance of maintaining high standards in the counseling profession and promoting client welfare. Professional integrity. Counselors are encouraged to act with integrity, honesty, and fairness. 21. Cultural sensitivity in ethics. Cultural sensitivity refers to the awareness and understanding of cultural differences and how they impact the counseling process. Key points. Respect for diversity. Counselors must respect and accommodate clients' cultural backgrounds, values, and beliefs. Culturally competent care. Providing culturally sensitive care enhances the therapeutic relationship and promotes better treatment outcomes. 22. Conversion reparative therapy. Conversion therapy, also known as reparative therapy, is an attempt to change an individual's sexual orientation or gender identity. Key points. Unethical practice. This practice is widely considered unethical and harmful, as it can lead to significant psychological distress. Professional rejection. Major mental health organizations oppose conversion therapy and advocate for acceptance of diverse sexual orientations and identities. 23. The personal is political. This phrase highlights the connection between personal experiences and broader social issues, particularly in the context of marginalization and oppression. Key points. Awareness of context. Counselors should recognize how societal factors impact individuals' mental health and experiences. Advocacy. Understanding this connection can empower counselors to advocate for social change and support clients in navigating systemic issues. 24. Cultural encapsulation. Cultural encapsulation occurs when counselors are unaware of the cultural differences that affect their clients' experiences and needs. Key points. Risk of misunderstanding. Counselors may unintentionally impose their cultural beliefs on clients, leading to misunderstandings and ineffective treatment. Cultural competence. It is essential for counselors to educate themselves about diverse cultures and adapt their practices accordingly. 25. Non maleficenza. Non-maleficence is the ethical principle of do no harm. Counselors must ensure that their actions do not cause harm to clients. Key points. Client safety. This principle emphasizes the importance of prioritizing client welfare and avoiding actions that could negatively impact their mental health. Risk assessment. Counselors should regularly assess risks and take necessary precautions to protect clients. 26. Beneficence. Beneficence refers to the ethical principle of promoting the well-being of clients. Counselors are obligated to act in the best interests of their clients. Key points. Positive outcomes. This principle encourages counselors to provide effective interventions and support that enhance their clients' mental health. Advocacy. Counselors should advocate for clients' needs and rights within the mental health system. 27. Fidelity. Fidelity is the ethical principle of loyalty and keeping promises made to clients. Counselors must maintain trust and uphold their commitments. Key points. Trustworthiness. Counselors build trust by following through on commitments and being honest with clients. Professional integrity. Maintaining fidelity ensures that counselors uphold the ethical standards of the profession. Conclusion. Understanding ethical and legal issues in counseling is essential for providing effective and responsible care. Counselors must adhere to ethical guidelines, respect clients' rights, and navigate complex situations with care. By prioritizing ethical practice, counselors can foster a safe and supportive environment for their clients, ultimately promoting their well-being and mental health. 4. Multicultural and diversity issues. Cultural factors in diagnosis family therapy with diverse populations, African American families, Latino families, Asian American families, Native American families, gender roles and stereotypes, intersexuality, gay, lesbian, bisexual, transgender, queer issues, sexual orientation, gender identity, transgender, cisgender, gender fluid, bisexual, homosexuality, conversion therapy, androcentrism, gender centrism, heterosexism, socialization effects on gender masculinity and men's psychology, cultural encapsulation, imposing cultural values, impact of poverty on development. Understanding multicultural and diversity issues in counseling. Multicultural and diversity issues are essential in counseling, as they recognize that individuals come from different backgrounds, cultures, and identities. Understanding these differences helps counselors provide effective support and interventions. This explanation will cover cultural factors in diagnosis, family therapy with diverse populations, various cultural groups, gender roles and stereotypes, LGBTQ+ issues, and more. 1. Cultural factors in diagnosis. Cultural factors can influence how mental health conditions are diagnosed and understood. Different cultures have unique beliefs, values, and practices that can affect how individuals express distress and seek help. Key points. Cultural expressions of symptoms. Symptoms of mental health issues may manifest differently across cultures. For example, in some cultures, emotional distress may be expressed through physical complaints rather than verbalizing feelings. Stigma. Cultural beliefs about mental health can lead to stigma, affecting whether individuals seek help or how they perceive their experiences. Example: an individual from a culture that emphasizes stoicism may not openly express feelings of sadness, making it challenging for a counselor to recognize depression without considering cultural context. 2. Family therapy with diverse populations. Family therapy can be effective in addressing issues within diverse families. Counselors must understand the cultural dynamics and values that shape family relationships. Key points. Cultural norms. Different cultural groups may have distinct family structures, roles, and communication styles. Counselors should be aware of these dynamics when working with families. Involving extended family. In some cultures, extended family members may play a significant role in decision-making and support, which should be considered in therapy. 3. African American families. African American families often face unique challenges related to historical and ongoing experiences of racism, economic disparities, and cultural identity. Key points. Strengths-based approach. Focus on the resilience and strengths of African American families, including community support and cultural traditions. Cultural identity. Understanding cultural identity and its importance in family dynamics can enhance therapeutic effectiveness. Example: counselors may incorporate cultural practices, such as storytelling or community involvement, into therapy to support African American families. 4. Latino families. Latino families may have strong cultural ties, and family is often at the center of their social structure. Understanding cultural values is crucial in therapy. Key points. Familismo. This term refers to the strong emphasis on family loyalty and support within Latino cultures. Acculturation. Counselors should consider the degree to which individuals or families have adapted to the dominant culture, as this can impact their experiences and challenges. Example: a Latino family may prioritize family needs over individual desires, which could influence therapy goals and interventions. 5. Asian American families. Asian American families often experience cultural expectations related to education, success, and family honor. Key points. Collectivism. Many Asian cultures emphasize collectivism, where family and community needs are prioritized over individual desires. Cultural expectations. High expectations for academic and professional success can create stress and pressure within families. Example: a teenager from an Asian American family may feel torn between their personal interests and their parents' expectations for academic achievement. 6. Native American families. Native American families have diverse cultures and practices, often deeply connected to their tribal identity and traditions. Key points. Cultural heritage. Understanding the unique cultural heritage and historical trauma faced by Native American families is crucial in therapy. Connection to land and community. Many Native American cultures emphasize a strong connection to land, community, and spirituality. Example: counselors may incorporate traditional healing practices or involve tribal elders in therapy to honor cultural values and community ties. 7. Gender roles and stereotypes. Gender roles refer to the expectation society has for how individuals should behave based on their gender. Stereotypes are oversimplified beliefs about individuals based on their gender. Key points. Impact on identity. Gender roles can affect how individuals view themselves and their capabilities, often leading to limitations in expressing emotions or pursuing interests. Challenging stereotypes. Counselors should help clients challenge harmful gender stereotypes and explore their unique identities. Example: a young man may feel pressure to conform to traditional masculine roles, leading to difficulty expressing vulnerability or seeking help. 8. Intersexuality. Intersexuality refers to individuals born with physical sex characteristics that do not fit typical definitions of male or female. Key points. Awareness and acceptance. Understanding intersexuality is important for promoting acceptance and reducing stigma. Individual experiences. Each intersex person may have a different experience and identity, and it is crucial to respect their choices regarding gender and medical interventions. 9. LGBTQ+ issues. The LGBTQ+ community includes individuals who identify as gay, lesbian, bisexual, transgender, or queer. Understanding LGBTQ+ issues is critical for providing effective support. Key points. Sexual orientation refers to whom someone is attracted to. Gender identity refers to how individuals identify their gender. Example: a transgender individual may seek counseling to navigate their gender identity and experiences related to transitioning. 10. Transgender, cisgender, gender fluid, bisexual, homosexuality. Transgender, individuals whose gender identity differs from the sex they were assigned at birth. Cisgender, individuals whose gender identity aligns with the sex they were assigned at birth. Gender fluid, individuals whose gender identity may change over time. Bisexual, individuals who are attracted to more than one gender. Homosexuality refers to attraction to the same gender and is not considered a mental disorder. 11. Conversion therapy. Conversion therapy is an attempt to change an individual's sexual orientation or gender identity. This practice is widely discredited and considered harmful. Key points. Ethical concerns. Conversion therapy can lead to significant psychological distress and is not supported by credible research. Acceptance. Promoting acceptance of diverse sexual orientations and identities is essential for mental health. 12. Androcentrism, gendercentrism, heterosexism. Androcentrism, the practice of placing male experience and values at the center of analysis, often marginalizing female perspectives. Gendercentrism, the tendency to focus on one gender's experiences while ignoring the complexities of others. Heterosexism, the assumption that heterosexuality is the norm, leading to discrimination against LGBTQ+ individuals. 13. Socialization effects on gender. Socialization refers to the process through which individuals learn and adopt the norms and behaviors of their culture. Key points. Influence of environment. Family, media, and peers play significant roles in shaping gender roles and expectations. Impact on identity. Socialization can affect how individuals view their gender identity and how they interact with others. Example: a child may learn that boys should be tough and girls should be nurturing, impacting their behavior and self-expression. 14. Masculinity and men's psychology. Masculinity refers to cultural expectations of male behavior, often emphasizing traits like strength, stoicism, and competitiveness. Key points. Cultural pressure. Men may feel pressure to conform to traditional masculine norms, leading to emotional suppression and reluctance to seek help. Mental health impact. Understanding men's psychology and the effects of toxic masculinity is essential for promoting mental health among men. 15. Cultural encapsulation. Cultural encapsulation occurs when individuals or professionals are unaware of cultural differences and impose their own cultural values onto others. Key points. Risk of misunderstanding. This can lead to misunderstandings and ineffective treatment for clients from different backgrounds. Cultural competence. Counselors should strive to understand and respect diverse cultural perspectives. 16. Imposing cultural values. Imposing cultural values refers to the tendency of individuals, especially professionals, to project their own cultural beliefs onto others. Key points. Respect for diversity. Counselors must recognize and respect clients' cultural values and avoid imposing their beliefs during the therapeutic process. Cultural awareness. Being aware of one's own biases and cultural influences is essential for effective counseling. 17. Impact of poverty on development. Poverty can significantly impact an individual's physical, emotional, and social development. Key points. Access to resources. Individuals living in poverty may have limited access to education, healthcare, and mental health services, affecting their overall well-being. Stress and trauma. The stress associated with poverty can lead to mental health issues, impacting development and opportunities. Example: a child living in poverty may experience food insecurity, leading to stress and difficulties in school, which can affect their long-term development and health. Conclusion: understanding multicultural and diversity issues is essential for providing effective counseling. Counselors must be aware of cultural factors, family dynamics, and the unique experiences of different populations to support clients effectively. By embracing diversity and promoting cultural competence, counselors can create an inclusive environment that fosters healing and growth for all individuals, regardless of their backgrounds. Developmental psychology. Neurodevelopmental disorders diagnosed in infancy. Childhood or adolescence, fetal origins hypothesis, human growth and development, plasticity, critical periods, Bronfenbrenner's ecological systems theory, microsystem, mesosystem, exosystem, macrosystem, Piaget's constructivism, Levinson's lifespan transitions, faith development. Childhood development, adolescent development, midlife crisis. Understanding developmental psychology. Developmental psychology is the study of how people grow and change throughout their lives, from infancy to old age. It explores various aspects of development, including cognitive, emotional, social, and physical changes. This explanation will cover key concepts in developmental psychology, including neurodevelopmental disorders, critical periods, theories of development, and stages across the lifespan. 1. Neurodevelopmental disorders. Neurodevelopmental disorders are conditions that affect the brain's development and functioning. They typically manifest during infancy, childhood, or adolescence and can impact various aspects of life, including behavior, learning, and communication. Key examples: autism spectrum disorder affects social interaction, communication, and behavior. Attention deficit hyperactivity disorder, characterized by difficulties with attention, impulse control, and hyperactivity. Intellectual disabilities, limitations in intellectual functioning and adaptive behavior. 2. Disorders diagnosed in infancy, childhood, or adolescence. Certain psychological disorders are specifically diagnosed during the early developmental stages. Recognizing and diagnosing these disorders early can lead to more effective interventions and support. Key examples: oppositional defiant disorder, characterized by a pattern of angry or irritable mood, argumentative behavior, and defiance toward authority figures. Conduct disorder involves behavior that violates societal norms and the rights of others, such as aggression, theft, or deceit. 3. Fetal origins hypothesis. The fetal origins hypothesis suggests that conditions during pregnancy, such as malnutrition, can have lasting effects on a child's physical and mental health. Key points: nutrition matters. Poor nutrition during pregnancy can lead to developmental issues in the child, affecting their growth and increasing the risk of health problems later in life. Long-term impact. Children who experience in utero malnutrition may have a higher likelihood of developing chronic diseases or mental health issues. Example: a mother who does not receive adequate nutrition during pregnancy may give birth to a child with lower birth weight, potentially affecting the child's cognitive development. 4. Human growth and development plasticity. Plasticity refers to the brain's ability to change and adapt in response to experiences and environmental factors throughout a person's life. Key points. Adaptability. This means that individuals can learn new skills, recover from injuries, and change their behavior based on experiences. Lifelong process. Plasticity is most pronounced during early development but continues throughout life. Example: a child who suffers from a brain injury may be able to relearn skills through rehabilitation due to the brain's plasticity. 5. Critical periods. Critical periods are specific times in development when certain skills or abilities must be acquired for healthy development. If these skills are not developed during these windows, it may be challenging to learn them later. Key points. Language development. There's a critical period for language acquisition, where children are most receptive to learning language skills. Vision development. Early visual experiences are crucial for normal vision development during infancy. Example: a child who is not exposed to language during the critical period may struggle to develop normal language skills later in life. 6. Bronfenbrenner's ecological systems theory. Bronfenbrenner's ecological systems theory explains